Well, good morning. Let's start with some encouraging news. Over the past month, Marion County has experienced a continued decrease in our positivity rate for COVID 19. Our 7-day moving average rate for all tests has fallen from 5.6% at the beginning of the month to 4.8% as of yesterday. That indicates that our public health efforts have lowered the transmission, or the rate of transmission of this virus. Because of the work that we have done together, we can now ease certain restrictions. But before we get to those changes, I do want to reiterate that I understand and I empathize with the frustration of Marion County residents and businesses. And those frustrations run the gamut. On one hand, many are dismayed when they see behavior that risks further spread of a deadly virus that our country struggles to contain. On the other hand, folks want to stay in business or return to a pre-pandemic lifestyle or simply find work. Against these challenges, many prefer restrictions of any kind be completely abolished. We all wish that this global health crisis had presented us with easy, painless public policy decisions. But the truth is, it hasn't, and it won't. There is, however, a strategy cities can use to save lives and ease economic strain, and that is contain the virus, mitigate the spread, and reopen as safely as possible in order to avoid a backslide. We can't completely ignore this pandemic any more than we can indefinitely suspend all economic activity, especially in the absence of congressional action to provide additional relief. I'm also aware that as rural parts of Indiana move toward a restriction-free reopening, frustration in our cities, in our urban areas, will grow. For Marion County, containment and mitigation will take a different form than anywhere else in our state. Marion County is twice as populous as Indiana's next largest county. We are also as big as all 8 surrounding contiguous counties combined. We are also a host of out-of-county Hoosiers who come here for work and for entertainment. Because of the population density, our approach will differ from rural and suburban counties. Frankly, it would be irresponsible if it did not. However, our approach will always be guided by the best available data and the consultation of health experts. And accordingly, starting next Monday, September 28, we will expand capacities for certain businesses as follows. Restaurants, bars, nightclubs, and food establishments may seat patrons at up to 50% indoor capacity and up to 100% outdoor capacity. Museums, cultural sites, music venues, and other similar entertainment businesses are now able to open to 50% capacity. Gyms, fitness centers, and similar businesses can also expand to 50% capacity. Consistent with this expanded capacity, live entertainment can resume at bars, clubs, and performance venues with certain social distancing precautions in place. Specifically, Dr. Caine is asking that a 10-foot buffer be maintained between stages and the audience, and that audience members socially distance themselves. Churches and funeral homes can now conduct indoor services at 75% capacity. As before, outdoor services have no capacity limit. For the moment, restaurants and bars will continue to be closed at midnight. I know this lost revenue is significant for many of our nightlife destinations, but we do believe the reduction in spread among younger residents has been driven in no small measure by this policy. As always, we will monitor the COVID-19 data for Central Indiana to determine the effect of these changes. And it will be this data and the judgment of our public health experts that will guide us in our recovery and reopening process. Beyond these efforts to mitigate the spread of the virus, city leaders and civic partners continue to work to mitigate the effects of the virus. Specifically, I want to thank the Indianapolis Marion County City County Council for approving my request to appropriate all remaining coronavirus relief funds from the federal action that was taken 6 months ago. This final slate of programs will pump millions more into efforts that address food insecurity, homelessness, rent and mortgage relief, and educational needs. These are important investments, important relief from the effects that the virus has. It will also allow us to provide direct grant assistance to restaurants, bars, and entertainment venues that are affected by these ongoing public health orders. We expect that this fund will top $10 million, and we will have more information to provide on that program in the next week or so. But make no mistake, these dollars aren't enough. They're insignificant in comparison to the effect this virus is having on businesses, small and large. But where we will continue to administer these dollars that we have been provided by the federal government, we will continue to do so in ways that we believe will have the largest impact. And we will continue to urge Congress to act to provide more relief for individuals and businesses. Finally, I want to acknowledge one question that has been on the minds of many parents and kids throughout Marion County. Halloween is approaching. We are currently analyzing the CDC guidelines and working with our public health experts to put together recommendations for Marion County families. We expect to provide an update on this sometime next week, nearly a month ahead of the holiday itself. So now I'd like to welcome Dr. Virginia Kane of the Marion County Public Health Department to provide all of Marion County with more information regarding the easing of these restrictions. Dr. Kane.
Thank you, Mr. Mayor Hogsett, and thank you again. Let me just say, the measures that we have put in place have just been so critical. We have seen significant lives saved. Our deaths have been brought down significantly. Our illnesses have just been phenomenal in terms of decreasing our emergency room visits. So I'd like to just give an update related to where we are now and our trends that have been happening in Marion County. Next slide. So one of the two major criteria that we look at that tells us that we are improving significantly in reducing community spread for COVID-19 is our positivity rate. Positivity means that the number of people who are tested positive over all the individuals that are tested in one day. And our critical indicator is that you have to be 5% in terms of positivity or less to know that you've made just incredible gains in terms of reducing community spread. If you can look on that little graph, you will see back in April, our positivity rate was over 20%. And we did wonderful. We came down dramatically in June, down to 4.2% positivity rate. But we probably opened up too soon, because then we saw another spike in our positivity rate. It reached almost 11% positivity back in the beginning of July, right after our July the 4th holiday. And we have, if you see this graph, since August the 24th, we have basically been just a little over 5%. And for the first time, September the 7th, 1 week ago, we reached below our 5% positivity. A remarkable accomplishment. And we've now been at least a week of having our positivity rate below 5%. Now, the next slide. So, and what's even more incredible, we're making sure that we are increasing the number of individuals in our community having access to be able to be tested. And so we have maintained over 1,500 tests. That's the minimum amount of tests that we need to know significantly that our data is correct. And we have been meeting those measures. Next slide. Now, there are two major criteria that we're going to use in terms of reopening up everything. Those criteria is the positivity rate that I talked to you about. And now the second most critical factor is the number of new cases that are occurring daily in Marion County. The number of new cases that are occurring daily in Marion County. And as you see, by the end of September the 20th, whereas we were reaching over 150 cases at the beginning of August, we are now down to about 85 cases on a daily basis. 85 cases on a daily basis. These two criteria, the combination of positivity rate and our daily newly confirmed cases per day, have to be at that level for a minimum of 2 weeks. And if we can do that for a minimum of 2 weeks, every child can go back to school in person. Almost everything will be almost near normal. And so these are the two criteria that I want you to look at. And I will reiterate, we need to get down to 35 cases per day. So if we can get down to 35 cases per day on a 7-day average for 2 weeks, our positivity remains under 5% for 2 weeks. Mayor, you can shout hallelujah, okay? Hallelujah. that we are there. Next slide. Our emergency rooms with COVID-19 symptoms are continuing to go down. So we've been basically, I want to say, flat for almost the past month. So we've been basically flat with our ED visits with COVID-19 symptoms. Next slide. Our hospital admissions, if you look at the overall from August the 24th, we've been basically flat for hospital admissions for persons with COVID-19. So for almost a month, we've been flat, and we're continuing to go down a little bit more for individuals who have been admitted to the hospital for COVID-19. That means they have a little bit more serious infection for the fact that they needed to be hospitalized. Next slide. And probably the most important factor of all, we have stopped losing lives related to COVID-19. These are what these measures have been put in place for. We don't have to lose a loved one. We don't have to lose a colleague. We don't have to lose a child. So I can't tell you how incredible for the public safety of our community that we are going in the right direction. I think very soon it will be a tremendous positive impact on our community, especially for the safety of everyone here in our community. And we're seeing on a number of days no deaths whatsoever for COVID-19. Thank you. Next slide. Now the demographics are continuing to change, and we got to keep track of this. So the number one age group that are seeing the most cases reported to us are the 20 to 39-year-olds. Nearly almost 45%, almost half of our cases are in that age group, 20 to 39 years of age. But look at the 0 to 19 years of age. When it was back to like 5% in May, it has dramatically increased to almost 24% of the cases from 0 to 19. Now, who are these cases? Well, would you believe that 3/4 of these cases are a little bit higher in our 0 to 19 or in our 18 and 19-year-old age groups? So the majority are 18 to 19 years of age. So, some of them are consisting of college students, that, for the first time may be out on their own, away from home. And then a lot of times people, see each other that they haven't seen since last year. And so it's been a tougher challenge for us to make sure that they are doing their social distancing and wearing their masks, especially when they are out in the public and they cannot do 6 feet social distancing. And when we look at our 60 years and older, they are only making up 11% of the cases. So that's incredible. And if 20% are in the 40 to 59 years of age. And I want to applaud every public health professional. I want to applaud essential workers that are out there who put their lives on the line daily. And their risk is 3 times the risk for acquiring COVID-19. Let me just say this again. Healthcare professionals and a lot of our frontline essential workers are at a risk 3 times higher than the general public. But they're doing an incredible job because they've been trained about infection control. They've had a lot of training. And even the individuals on our front lines, we're continuing to do the training. And I just have to thank all those agencies and entities that are involved in helping our public, whether you're a grocery store, whether you're Indigo bus, all the school systems. This has been a very important point. And we want you to continue to wear masks, Wash your hands frequently. Disinfect your place where you reside, where you may work. And of course, do the 6 feet social distancing. Next slide. Now, effective this Monday, our indoor bar capacity will be increased to 50% indoors, and outdoor bar and restaurant capacity will be increased to 100% outdoors. Live entertainment is permitted, but venues must ensure that there's a space of 10 to 15 feet from a performer and an audience, and they must follow social distancing guidelines. Religious services may operate at 75% capacity indoors and unlimited outdoors. Gyms, fitness studios may operate at 50% capacity. For all those loved ones who are in assisted living or in long-term care facilities, our assisted living facilities may be open to indoor visitation based on the Indiana Department of Health, State Indiana Department of Health guidelines. So assisted living facilities are open to indoor visitation. Next slide. Now, our hybrid models applies to schools greater than 400. But for the first time, from all schools that are kindergarten through 8th grade, they can now go 100% in person. So the past order was just only from K to 5th grade, but we're extending that now from K to 8th grade, can go in person, and you can have your social distancing from 3 to 6 feet for the K through 8th grade. 3 to 6 feet, okay? But 9th grade to 12th grade will only be able to go 100% in person when our positivity rate is 5% or lower, and the daily number of new cases is 35 on a 7-day average or lower for 2 weeks. Let me say this again. When can all schools go back in person? That if we have a positivity rate that's 5% or lower, and if we can have a daily number of new cases averaging over 7 days of 35 or lower for 2 weeks. And this is based on CDC guidelines that we are utilizing for that criteria. 1,500 individuals are allowed to attend outdoor athletic events, and this is for the schools. So for if you are a K through 12 school, 1,500 individuals are allowed to attend outdoor athletic events, and 500 for indoors, or 50% capacity of that venue, whichever is less. This is orders just for K through 12 schools. 1,500 individuals are allowed to attend outdoor athletic events, and 500 for indoor, or 50% capacity, whichever is less. Next slide. So thank you, Mayor. And let me just say, I want to thank everyone in the public who's been doing an incredible job safeguarding not only themselves, but all of the key people in our communities. You know, our children deserve a safe arena. Our seniors deserve a safe public environment. Only you can make that happen for us, okay? This is a shared responsibility for all of us to make a difference. And we can make a difference easily if we're able to follow the major measures that we put in place for all of our safeties. And we do have to follow the science and the data. The science and the data helps us drive our decision making. And again, I can't applaud Mayor Hogsett enough and his team and his staff. An incredible job that he's doing. I have to thank my expert panel members, Dean Paul Harrison and a number of his faculty for the Indiana University Fairbanks School of Public Health. And we have a number of experts that we utilize, funded from the CDC Foundation, that provides us expertise in helping for us to make the decisions. And we use material sometimes from Johns Hopkins and Harvard's recommendations in order for us to make our decisions. But know that we look at the science in terms of how we make our recommendations and lessons learned. You know, we learned a lot of lessons at the beginning of this epidemic, so that we're able to use those lessons we learned how to make and continue to make, I think, are good decisions. So, Mayor, I'll turn it back to you for questions.
Great. As always, if you'll put your name and outlet in the Q&A box, we'll call on you and unmute your microphone so you can ask questions of our group. Our first question is from Nicole Griffin at WRTV.
Hi, Mayor Hogsett. I know you mentioned about the COVID-19 relief funds for businesses, et cetera, and that there would be more information coming soon. Any timeline on that? I know a lot of businesses are very concerned with, how they're doing moving forward.
Yeah, I would hope to make an announcement within the next week, perhaps as early next week, because these funds have now been appropriated, and we need to use them. So I'm hoping that some announcements of our efforts can be made early next week.
Eric Berman at WIBC.
Hello, Mr. Mayor. I had a question for you and a question for Dr. Kane, and I think I can fix the reverb here. With respect to the mask mandate, the governor said on Wednesday that some restrictions and changes in how we live may continue for a full year. Does that apply in Marion County's case to the masks, even after we hit that 35 a day that Dr. Kane was talking about? Can we expect the mask mandate to continue?
So sorry, I don't know if you can hear me. So we are really looking at that very carefully in terms of whether it will continue after our deadline of the 35 daily cases and less than 5% positivity rate. So we have not made a final decision related to that. And so we want to continue to look at our numbers and see how well that they are dropping.
And my other question, which is definitely for you, why the difference between K-12 sporting events and other sporting events?
So a lot may depend on what we look at is the transmission rate of the criteria. For example, we have very little transmission of cases of individuals that are K through 12. So if you look at K through 8, we've looked at our data carefully, the more recent data, and we're seeing that we're not seeing that amount of transmission of cases. So, and then when you look at middle school, we were not seeing that transmission of cases. That's why we've allowed everybody to go in person. But when you compare the transmission rate from the 9th to the 12th grade, it is even less compared to some of the colleges. So we're looking to see in universities what those numbers will look like and the safety precautions that have been put in place to assure ourselves that our numbers are not going to go up. Because as we understand it right now, from 20 to 29, they're making up 45% of our cases totally in this community. So we have to look at that very, very carefully.
Next up, we have Ethan May from the Indy Star.
Hello. Will bar seating be opened? Will patrons be able to sit directly at the bars under the new ease restrictions?
So the answer to that is no. Unfortunately, that is still too close of contact, less than 3 feet easily exposed to another individual. And we've seen our cases increase along that arena, so we're keeping that still closed for right now.
Tom Healy, Midtown Magazine.
Morning, Dr. Kane, a couple for you. You mentioned specifically the attendance at outdoor athletic events at schools. What about the general large public events? Is there any, I think I understood that it was, if you had a 250 or more anticipated to attend, you needed to put a safety plan in place. Has that changed? And then also a question about how many businesses have been cited for violations to date and whether any fines have been issued or businesses shut down.
So that has not changed in that capacity. And yes, we've had a number of businesses that have been fined. I'll have to get to you later the number of those businesses, but we've had a number of $1,000 fines for businesses that have had violations.
Abdul Hakim Shabazz, Indie Politics.
Good morning, Mr. Mayor. Morning, Dr. Kane. A couple of questions for you, Mr. Mayor. Granted, you're going to have more announcements next week on the CARES Act funding, but do you have any idea what sort of amounts might be available for bars and taverns, or the formula that you folks might use to determine how much they can get? And my second question kind of goes to the possibility of maybe some riot activity this weekend. You cautioned against boarding up downtown, so that might be a bad sign for the protesters. What about businesses that are worried about their businesses and everything, particularly after the last couple riots we saw earlier this year?
Well, Abdul, let me answer your second question first, and then I'll throw it to Thomas Cook in terms of your request as to how much money may very well be available to our bars and restaurants. You know, the IMPD, first of all, we're monitoring every place in the country. Louisville obviously has had a lion's share of attention because of the Breonna Taylor decision that was made this week. So we're monitoring very closely what Louisville is experiencing. But what happens anywhere in the country today affects everywhere. And so we will continue to monitor to the extent that public protests are organized here in Indianapolis. We will protect the rights of citizens to protest publicly, but we will take all available and necessary steps to protect against any kind of vandalism, looting, or other forms of violence, particularly protecting the businesses downtown. That doesn't necessarily mean that the protesting will be limited to downtown. That's up to organizers of the protest. And we do keep in close contact with organizers of public protesting. So I think that the best practices that we have developed and learned from over the course of the last couple of months will help us keep whatever protesting occurs protected, but also peaceful.
And then Thomas, I think the mayor pitched it to you for the first part of Abdul's question.
Yeah, no, I appreciate it, Mayor. Appreciate the question, Abdul. To just give 30 seconds of historical context. So we received $168 million under the CARES Act that was passed back in March. That legislation and subsequent Treasury guidance says that we have to spend essentially, and by spend, I mean have dollars out the door and into the hands of those who need it by December 30th of this year. Since that time, the City County Council approved outside of the CARES Act about $25 million of Paycheck Protection Program loan liquidity that was administered by the Indy Chamber. And they've also approved roughly $17 million in existing small business and nonprofit grants for things such as PPE. 5 million of that 17 million was to essentially buy into the state of Indiana Small Business Assistance Program, which would have otherwise not included Marion County. And earlier this week, the state of Indiana announced that due to some underutilization they were seeing in their program, they were going to change some of the rules and requirements. In doing that, the city maintained a $1 million commitment for Marion County businesses through the state's program. And I mention all of that because one of the exercises that we are attempting to undertake very quickly as it relates to this small business assistance program for the hospitality industry is to ensure that if we have other programs that are being underutilized, we are redirecting those dollars into this program that we believe is both incredibly necessary, but also will have very high demand once it is launched. So the City County Council approved a week or so ago, $7 million roughly for the Small Business Assistance Program. But due to the underutilization of the state program and some other pots of money that we're attempting to identify, we do believe that that program will be in excess of $10 million, as the mayor said in his remarks, once it is launched. And so that's really going to drive, Abdul, your fundamental question about what dollar amounts individual businesses will be able to apply for, because that final sort of larger amount of money will then sort of at a proportional level be offered to businesses. We do expect, though, that the per business cap will be at least $25,000 per business in terms of providing 3 months of prospective grant assistance for rents, mortgage, and perhaps some other fixed expenses. So that's, in our view, the floor. We're attempting to identify as much funding as possible, and that's really driving the timing of the announcement, is ensuring that if we have the ability to raise that maximum award level to higher amounts, which we know absolutely will be necessary, that we're able to be clear about that from the outset.
Great. Next, we have Kelly Ranke from Fox 59.
Hi there. Good morning. I have two questions. The first one is just for clarification. I assume at bars and nightclubs, this also means that dance floors are still closed and patrons need to be seated. Is that correct?
Yes, that is correct.
Second question, I think Dr. King, you may have answered this quickly, but I'm hoping you can elaborate a little bit more. How did you decide on the 35 case number? And given how Marion County is performing right now, do you have any idea when the county may be able to get to that threshold that you're looking at?
So first of all, let me just say, based on the CDC guidelines, they give out recommendations based on when you should reopen everything completely. They have a number that's what they call a high transmission rate. If you reopen everything up, this is how soon you could easily see a peak in cases. So they have a high risk number, they have a moderate risk level number, and then they have a low risk for transmission ever happening again. So we decided and elected to do the moderate risk transmission number of cases, which is 35 cases. For the lowest of low risk, it would be 20 cases we need to reach getting down to. And if you had set it at 50 cases or higher, that's the highest risk for transmission. But we were trying to do a balance because we know how devastating from an economic standpoint it is for our businesses, a lot of workers or whatever. So that's how we chose the 35 daily cases. We are happy to provide that link for you to look at that document and review. And so now when do we think we can get close to that? And I don't know, am I allowed to predict, Mayor Hogsett? Or do I get in trouble?
You're the public health expert, doctor.
Okay, so I am hoping that we can reach that number by November the 1st. Don't forget, I got to have positivity rate at under 5% for 2 weeks. Now I'm already 1 week with the positivity rate. Okay, but my cases are still at a daily average of about 86 cases. And so if everybody practices right, we should easily make that November the 1st deadline. It all depends on everyone in this community about their shared responsibility.
Next question is from James Briggs at the Indy Star.
Dr. Kane, now that you're in the business of projecting the future, I have a related question for you.
Oh, wow.
A lot of people are going to reject the explanation that you've provided that there's any good reason why bars can be at full capacity surrounding Marion County, but not in Marion County. So based on the months of data that you've presented here and that brief period when Marion County already had looser restrictions than it has now, can you describe as specifically as possible what the projected outcome would be if Marion County immediately adopted the same guidelines as the state?
So I would honestly say, and let's think about this too. Look at all the surrounding counties, and they're able to have their bars at 100% capacity. Well, I look at the number of colleges that we have here and the number of students that we have that will utilize our bars compared to, you look at the surrounding counties, they don't have near the number of individuals at that age group, okay? And we've seen recent cases, unfortunately. I think you look at Indiana University, their recommendation was to shut down 50% of their fraternities and their sororities. And just, I think 2 days ago, they closed fraternity completely. So for certain age groups, sometimes, unfortunately, they don't always practice what we consider good measures to prevent the infection. The other thing is, when we shut things down, we had over 50% of our complaints coming from the bars and the taverns, okay? That were not following the measures like they should. So we're so close. You know, we were close last time. We got excited. We got down to 45 cases per day, and we got down to 4.2% positivity. And that was, and instead of waiting the 2 weeks of seeing those measures last for 2 weeks, when governor went up to stage 4.5, we said, oh, we immediately jumped on there and jumped up. But unfortunately, I think this is a lesson learned. We went too fast compared to the state, and they're different. I think Mayor Hogsett told you. You look at our population density. When our folks get infected, it has a greater outbreak of cases compared to you in any of these smaller counties. So it's a greater risk for spread of infection, which has occurred for us, unlike our surrounding counties.
Great. Our next question is from Tom Davis at the Associated Press.
Hello, Dr. Kane. What do you think about the reduction in statewide, restrictions by Governor Holcomb in his Stage 5 plan? Is that the correct move to be making now? And what impact do you think the resistance in many parts of the state to mask wearing is having on Indianapolis?
So, you know, the governor has a really tough challenge before him. And he has a tough challenge because every county's not alike. And so he tries, I assume, to make recommendations that he's hoping will cover all counties. But he's a smart governor. Let me tell you why. Because he has always allowed recommendations for what's happening in the local community under the authority of the local community if the restrictions are greater. He is saying on the level, you know, you may have some expertise, you may have some additional information that I don't have, and we're allowing you to make those recommendations if you indeed feel you need to make them. And so he has that caveat, is sort of like a reserve piece of safety that he realizes the leadership from the local counties we know what's happening, where he may not always have that access, so that he's making his decisions from a broad base of information, but totally one size doesn't fit all.
Great. Our next question is from Sam Quinn at the IBJ.
Dr. Kane, does the public health order you're issuing now affect or change the number of people who will be allowed at professional sporting events like, say, at Lucas Oil? And then can you explain how the health department is deciding what the capacities in those venues should be? We've seen them sort of change from week to week and from sports team to sports team. So just some clarity on that, please.
Yes, so let me, because I got a lot of attention about 7-11 recommendations for spectator capacity versus the Indianapolis coach. So let me just go in and address that head on in case people didn't catch it in IBJ or the Indianapolis Star. So, I'm sorry, Indy 11, I apologize, sorry. Way before we had the requirements to approve plans, Indy 11 just sent us a plan, just trying to say, hey, we want to make sure we're doing the right thing. We're putting things in place and blah, blah, blah. These are the measures we were putting in place. And at that time, when we were seeing that plan, we were at 45 cases per day. Our positivity rate was down to 4.2%. So, we didn't even think about it. I think they used 5,000 capacity, but we weren't even required to even approve the plans until later. And then I just want to say, I just forgot about Indy 11. I'm just, because we never got a plan resubmitted by them after it was now a requirement to have your plan approved. And so we didn't realize that they were at the 5,000 capacity because we really didn't talk about it when they initially presented their plan to us. And so when it was identified to us, we immediately corrected that issue and issued a restriction to Indy 11 that they had to be at the same level as the coach at 2,500 spectators. Now, how are we handling the spectators? Okay. In the numbers, we look as our numbers go down, and then as they improve, we're cautiously increasing the number of spectators. We're seeing that everything is put in place and everything is correct. I have to honestly say, we wanted to see the outcome of the 2,500 spectators from the Indianapolis Colts, and they even, whoever the key person is for the Colts, but you really even exceeded our expectations how well it went with the social distancing, and their plans were excellent and whatever. So we then said, hey, you can now go up to 7,500. I believe a week later, if everything is going to plan, and this is the caveat we always tell everybody, as long as we're continuing to reduce our numbers, we will let you go up to, I think, the Indianapolis Speedway, which is going to have an event in October. We're allowing you to go up to 10,000. So if I continue to look at these numbers, I will tell those sporting venues, okay, I may have you go up to 15,000, okay? So we are looking at that.
Great. We've got about 11 minutes left, so I'm going to try to get through as many of these questions as possible. Erica Heron from the Indy Star.
Hi, thank you. Just one quick clarification, and that's on the 35. That is total new cases, and that's not per 100,000 residents, correct? And then can you also explain?
Yes, so that's 35 new cases a day, new confirmed cases a day, but we have to look at what we call the 7-day average. And that 7-day average has to last longer than 2 weeks, at least 2 weeks.
Okay, thank you. And then can you also explain why the county is looking at, for the positivity rate, why they're using the all test rate versus the individual testing rate?
So our experts believe that that's the better test to utilize to measure for active infection, active spread. Some of the measures that are used for positivity goes back from all the way from March, including all those cases, bringing it up currently today to measure their positivity rate. But we primarily like to look at the positivity rate based on what's happening that day, the people who are positive versus the cases looking at positivity rate since the epidemic started. And they're trying to combine all of the trends from March the 8th. And we're just really interested in having a better idea what we call the incidence. What's the current number of infections that are occurring currently? And honestly, no one measure. A lot of the states, a lot of the cities use one or the other measure And I can't say either one is wrong. It's just a different perspective in terms of how we look at our positivity rate.
Sherry from the Indy Star.
Hello, can you hear me? Okay, thank you. As a follow-up for that, I'm wondering, Dr. Caine, if you could talk a bit about where we are right now with testing turnaround time and contact tracing, how things are going in those arenas.
So I would tell you that for testing and getting the results back, I would say that 90% of the individuals are getting their results back now from anywhere from 2 to 4 days, 90% of the individuals. Now you have another 10% sometimes don't get the results because one, some of these information may go into spam if they're getting the results back to their email addresses. Sometimes people put their wrong email address down there. So it takes us a while to find out that, they're waiting for their test result and we don't know that they didn't get it because the information may be incorrect that they provided for us in order to reach them for that last 10% of individuals. But we're trying to work really hard on the messaging related to that.
Great. We have Eric Weddle from WFYI.
Hi, Dr. Caine. Have you provided any recommendation or guidance to whether schools should publicly release information on COVID cases for their students and teachers and staff, like we're seeing Wayne Township and a few others do?
So explain it to me. What are you saying now?
Are you in favor, or have you provided any recommendation for school districts to provide their own dashboard of cases of their own students and own staff so the public can see the cases within a school district or a school?
So we have had some dialogue related to that, but we have not made any official recommendations related to that. We have allowed each school district to make their own decision related to that.
We have Russ Dodge from WITT.
I wanted to get a little elaboration on the rules for the restaurants. As I understand, 50% indoors, 100% outdoors now. What is the plan, if there is one, for as the weather gets a lot colder and that outdoor seating is no longer really feasible?
The chances are pretty good that we're going to increase the indoor capacity.
Great. We have a question from Mary Mills at WTHR.
Can you hear me? I have a question for Dr. Caine and for the mayor. For Dr. Caine, what changes, if any, will be coming to the Indiana Convention Center and, say, performing arts centers? And for the mayor, just wondering if you have consulted with the mayors of the excluded cities such as Lawrence Beach Grove Speedway, and if not, why?
Is this a question to me or is this a question for the mayor?
Dr. Caine, I think we had two separate questions.
Oh, so what's the separate question for me?
Mary, question for Dr. Caine.
What, if anything, changes, say, for the Indiana Convention Center in terms of numbers or policies, and the same for performing arts centers, theaters, that type of thing?
So let me just say that we're in constant communication with Andy Mellon in the convention centers, talking about and laying out our groundwork for what numbers of people we can have in the convention and what kind of precautions can they make. And so we're hopefully, we want a robust convention center, and it's important that we need to try to get the hospitality folks working and whatever. So we are working very closely looking at those numbers tentatively for the month of October and whatever. So look to see more conferences and events at the convention center, as well as discussions with culture and arts, entertainment individuals.
And in answer to your question, Mary, not only do we have conversations with all the rest of the mayors inside the county, but I participate actively in the organization that's known as CICEO, or Central Indiana Chief Elected Officials. I can tell you that obviously those conversations are usually Zoom calls now, have been for quite some time. I can tell you that COVID is a topic that has dominated the discussion, that including all of Marion County, but even the contiguous counties. And then I actively also participate in Zoom calls that are sponsored by AIM, the Association of Municipalities, that used to be known as IACT. We have usually monthly mayor's leadership calls, and that's for really all of central Indiana. And there is robust conversation about COVID-19. I'll be candid, a lot of that conversation involves what's going on in Washington and how likely it may be that local units of government and state governments who are asking for more financial relief, how likely it is that that relief may be coming. But we also talk about public health concerns, and obviously they are following the direction of their county experts. And so, but we learn from each other. And just to reiterate a point that I made during my opening remarks, we do have fundamentally different issues in Marion County. I mean, it's just without question. The population of the contiguous counties now totals nearly as many people in the aggregate as Marion County. But even those counties individually have fundamentally different challenges than what we face here in Marion County. So we have robust discussions about COVID-related matters, but we also acknowledge, each and every one of us, that our situations may be different than our fellow mayors in other communities.
Great. And our last question is from Tom Healy at Indy Midtown Magazine.
Thank you. Dr. Caine, your colleagues in the epidemiology department put out a regular situation report, and there's been some really consistent reporting on the demographics of those most affected and the highest percentage of deaths, and those remain the Black, non-Hispanic, and Latinx populations. I'm just wondering, can you tell me what steps Marion County Public Health Department is doing to address these disparities?
So I'm glad you asked that question. When we look at our data, of course, the largest racial and ethnic population by percentage of people infected per 100,000 populations are our Hispanic and Latinx population. With the African Americans, and they're like twice the rate as their white counterparts. When you look at the African Americans, they are where the Hispanics are almost 3 times the rate as our white residents. African Americans are roughly about 2 times the number of cases as our white counterparts, followed by the Asian Pacific Islanders, who are the third group higher than our white residents. But when you look at the hospitalizations and the deaths, by far, African Americans are much greater related to hospitalizations and graded to deaths compared to any other racial and ethnic population. The mayor and I, just this week, had a very great meeting, I believe, with the Hispanic or Latino Alliance Coalition. And they identified some very great points that we had not always been aware of, that there's a great need for us to direct resources in that area. So we are going to be working with our Latino population and our Hispanic population, our African American population, and our Asian Pacific Islanders, of which the Burmese are a considerable other group that needs special resources that are unique to them. And so we will be meeting with the other African American leadership related to their needs, and we will be meeting with the Burmese population based on their needs. And we're going to have continual dialogue, and we're going to, I believe, make some tremendous progress to really meeting the needs of all of those particular groups, because they do impact our numbers considerably, and we want to make sure that they're getting the education they need from protective measures. You know, they need to know about the hand washing. We need to make sure we're continuing. I think the mayor had a major step when he was providing free masks for individuals who could not afford it. But let's be honest. You know, they may be evicted from their places where they reside. The utility bills may be cut. You know, how do I access food? And so the mayor and his staff are working aggressively addressing those areas that they are more responsible for. And as a health department, we are addressing those social determinants of health that's really critical for them to survive. And we're aggressively working on that because we want to be ready. Fall may be a double whammy. I got to remember to tell everybody this. Thank you, last questioner. I need everybody to get your flu shot. Everybody get your flu shot, because fall comes, we may have a double whammy with influenza going on as well as COVID-19. And so those are some of the kind of things that we are looking at, so to make sure there's access for them to get those kind of measures, especially if they may be uninsured.
Wonderful. Thank you all for joining us today. A copy of the press release, the presentation that Dr. Caine gave, as well as the public health order will be going out a little bit later. Thank you so much.